Hello, my name is Ravi Vij. I am here, and today we have Dr. Samir Hadidi, Associate Professor at the Myeloma Center at the University of Arkansas, a leading center for myeloma for a long time. And he's here today to discuss results of the AQUILA study, of phase 3 trial of Daratumumab versus active monitoring in high-risk smoldering myeloma, which was presented at the American Society of Hematology meeting in December 2024 for the first time. So welcome, Samir.
Thank you so much for having me.
So let's go ahead and review the trial, and then we will talk about how you intend to incorporate this in your practice. So can you tell us about the trial design?
Yes, certainly. AQUILA study is, an international phase 3 clinical trial that included patients with smoldering multiple myeloma. The definition at that time when this study was done was a little bit different than what we consider as high-risk smoldering myeloma nowadays. But that included patients who got diagnosed with smoldering myeloma for less or equal to 5 years, and they have certainly some features that may resemble high-risk smoldering myeloma, including immunoparesis and involved free light chain over uninvolved of above or equal to 8, and clonal plasma cells of more than 50 up to 60%. And as you can see in the slide, 390 patients were randomized to get either daratumumab or active monitoring in one-to-one fashion. The daratumumab dosing is quite usual for what we use in myeloma. It starts weekly for the first 2 cycles, then every other week for the 4 cycles, and after that, once every 4 weeks for a subsequent cycles up until 3 years. And those patients were followed for progression-free survival, and secondary endpoints were including overall survival.
So what can you tell us about the demographics of the patients accrued?
So as you can see in the slide, those patients were typical of the smoldering myeloma patients we see in clinic. So patients were older. Vast majority of patients in this study were 65 or older, almost 50% in both of those groups. Mostly those patients have ECOG of 0 to 1.